Very good evening to our viewers. Thank you for joining us tonight on the evening review. My name is Toibonje Bella. Tonight on the platform we are joined by Ben Nangombe. He is the Executive Director in the Ministry of Health and Social Services, and he is here to just bring us up to speed with some of the latest in the ministry and the public health sector in general. Thank you, Ben, for making time. It's been a long time since you came here.
Yeah, thank you,
So we thought we had lost you completely, but our hope is restored that you're back now.
I don't know. You haven't invited me in the meantime.
That's a fair point also. Yeah, Ben, first congratulations, because we saw screaming headlines this morning about the success in the in the transmission of HIV from mother to children, the pregnant mothers, that nearly 99% of infected mothers no longer pass that virus to their babies. I think it's a huge development for our country. What was the recipe for the success of that nature?
Yeah, no, thank you very much. It's a huge milestone for public health in Namibia.
Yeah.
I think what needs to be said is the prevention of mother-to-child transmission of HIV and hepatitis B are part and parcel of the broader national HIV/AIDS response. You remember at the end of the 90s, beginning of the 2000s, our health facilities were crowded with persons suffering from complications related to HIV infection. It is from there that we actually started in earnest to combat the scourge of HIV/AIDS. And the prevention from mother-to-child transmission of HIV and hepatitis B, we started in earnest doing that around 2002. Basically, what is being said is that pregnant mothers are capable of, or the virus is capable of being transmitted from a pregnant mother to a child in utero. The hepatitis B virus also is capable of being transmitted from a pregnant mother to a child in utero. That is what they call vertical transmission. Now, because if a child is born with HIV, their health is compromised, and many would die at a young age. So there were interventions implemented in terms of providing antiretroviral treatment, which reduces the viral load in a mother so that it's not transmitted to the unborn child. So what happens is that we have encouraged and have made it a matter of policy that each and every pregnant mother who comes for antenatal care at her health facility is tested for both HIV and hepatitis B. If a mother is found to be positive for HIV, they are immediately initiated on treatment. With respect to the hepatitis B virus, the mother are given a vaccine, and that vaccine would again then prevent the transmission of the virus to the unborn child. Because there's no specific treatment for the hepatitis B virus, if a woman is hepatitis B positive, they of course get supportive treatment to help them remain healthy. But this is embedded in the programs that we provide as part of the HIV/AIDS national response. So what has therefore been happening is that with the introduction of these interventions where women are tested when they come for antenatal care, and when they are positive, they are initiated on ARVs, we have seen the transmission rates go down. to the point where 99% of the children, it's actually 98% of the children born to HIV positive mothers are HIV negative. So they are born healthy. And that's why we are saying this is a very important milestone. Last week, we had an international conference here in Namibia, initiated by the WHO, relating to investments in the Africa healthcare workforce. So the regional director of the WHO, Dr. Mweti, of the WHO Regional Office for Africa, came and handed over a certificate of recognition to Namibia, to the Prime Minister of Namibia, on behalf of the President, that Namibia has done well. And I think one thing that must be pointed out is also that with respect to the prevention of the transmission of the hepatitis B virus from mothers to children, Namibia was actually the first country in the world to be certified by the WHO to be on the path towards elimination of this virus to unborn children. And we have seen basically the vaccination rate for the coverage of this hepatitis B virus being very high. I think it's approaching 90% in the country. So for that reason, we are very, very pleased. But I think what again must be noted is that this success is not necessarily the success only of the Ministry of Health and Social Services. It involves all the stakeholders. We deal with communities, the people who are living with HIV infection. Many of them have formed what we call adherence clubs. And the adherence clubs basically people who are living with HIV encourage each other to be able to remain on treatment, and also when they feel unwell to seek treatment at facilities. We have made it a point, for example, we have put in place a policy whereby those that adhere to treatment, we provide them with multi-month dispensing of ARVs, so that a person who is HIV positive and adheres to treatment, they get their medicine for up to 6 months. Therefore, they don't have to be going back and forth every other week going to a health facility to collect their medicine. We have put in place something called Pele boxes. The Pele boxes are machines that are placed at strategic places, particularly health facilities. A person who is prescribed medicine for chronic condition receives an SMS, goes to the Pele box, they receive a PIN, and they will find their medicine in there. So they don't have to go and wait at the health facility, at a pharmacy. They will find their medicine in something that looks like a post office box. You go there with a PIN and you are able to receive your medicine. So these are some of the innovations that we have put in place to make sure that our people remain on treatment. The other intervention is the deployment of community health workers. What the community health care workers do is encourage members of the community to again remain on treatment, whether it is for HIV, whether it is for malaria, whether it's for TB, whether it's for other illnesses, whether it is about also perhaps nutrition for nutrition education, particularly for lactating mothers and their children. So, and then we have also human resources that are funded or supported by our development cooperation partners, such as the Global Fund, PEPFAR, and others. So it's a whole ecosystem that works to bring us where we are, and we are happy that Namibia could have been recognized in this manner for the world to see that there are some good things happening in the public health sphere in Namibia. We are moving towards ending AIDS as a public health threat, because that's our aim, to end HIV/AIDS as a public health threat by 2030.
Okay. Speaking of the HIV as a public health threat, there's this impression, especially among young people, that now I hear jokes, people saying, nah, when last did you hear of someone who died of AIDS? Those things no longer kill people. Very negligent rhetoric. How is the prevalence of HIV in the country right now?
Namibia has done very well. In fact, again, I think it was in February last year, where Namibia was given a recognition by the ambassador responsible for global health security in the United States, the agency that under which PEPFAR is being implemented, for moving towards the elimination of HIV/AIDS as a public health threat in the country. But we still have new infections happening. I think the last statistics that I saw, the new infections that we are dealing with currently amounts up to about, I think, more than 5,000, between 5,000 and 7,000 infections per year. But as much as that number may seem low, we are saying everybody has a responsibility to behave in a manner that we want to end HIV/AIDS as a public health threat by 2030. This is a goal that is important for public health in Namibia. We still have individuals, particularly individuals that we refer to as those that are left behind, particularly the young men. I think they have become complacent in a way. And that is a demographic that is driving the new infections. And that is a demographic that we are focusing on as a ministry to make sure that they understand that AIDS can still be dangerous. And we need to make sure that we stop new infections. That said, yes.
Just on that, why men in that age group, and what about women in the same age group?
Yeah, I was going to say the women, also the young girls, are vulnerable. We know of the sugar daddy phenomenon. Young women are enticed by men with means, particularly, to engage in these affairs, and therefore many of them would, for example, engage in unprotected sex, and as a result, they pick up new infections because of intergenerational sex. So that is also a group that is at risk. And these are the groups that we are focusing on to ensure that they are better protected, they understand, and that they are able to make the right decisions when it comes to these matters. So we are saying we know exactly which groups these are and how we are going to attend to them and to encourage them to protect themselves.
Yeah. Before we go on a break, Ben, when you're saying the aim is to eliminate HIV as a public health threat, what does it mean?
Yeah, it basically means that we have to come to a situation where the new infections and deaths related to HIV infections are drastically reduced. We are looking, for example, for Namibia to say by 2028, on the 95 fast track targets of UNAIDS, we want to be at 97, meaning that by 2028, we want to ensure that 97% of the people who are HIV positive in Namibia have been tested and they know their status. And 97% of the people who are tested and know their status are initiated on treatment, that they are on ARVs and they are regularly taking their medication. And then 97% of the people who are initiated on treatment are virally suppressed. Virally suppressed basically means that the people would have taken their medicine, they are taking their medicines regularly, and the viral load in their body is reduced to the extent that because the viral load is so low, they will not be able to transmit it to other people. Also, we have this terminology that says undetectable means untransmissible. So if a person's viral load has been reduced so low, they are not able to pass it on to the next person. And by that, we will then have a situation where HIV/AIDS will no longer be regarded as an epidemic in our setting, because new infections and new deaths would have been reduced drastically.
Absolutely. We go for a short break and then return with Ben Nangombe.
Connection. It's in the human touch, the feeling of belonging. It inspires us and empowers us, creates clarity from complexity. It starts new conversations, unlocks the power of advice, and makes an impact on your life. At Alex Forbes, we pioneer insight to provide you with advice that connects your decisions of today to your impact tomorrow.
The conversation continues on the evening review with Ben Nangombe. Now, Ben, another report that came out in the newspapers this morning is about AstraZeneca, the COVID-19 vaccine that has been discontinued in, especially I think in Britain and elsewhere. And, people have attached a lot of theories to why that happened. My reading is that the new variants require different vaccines now because they are not responding exactly to this old thing, because these are new infections and stuff like that. It's a technical explanation. But people think it was discontinued because it's killing people. And you came out this morning in the Namibian saying there's actually you have no knowledge of any such situation in Namibia where people are dying because they took that vaccine. What can you tell us about that?
Yeah, basically, I think the point of start is to say the AstraZeneca vaccine was one of the vaccines in our portfolio that we were utilizing together with Covishield, Johnson & Johnson and others to vaccinate people against COVID-19. The AstraZeneca vaccine particularly, for Namibia, it did not see a lot of uptake because when people come for vaccination, they will say, I want J&J, I want Covishield, and things like that. The uptake for AstraZeneca was slightly lower than the other vaccines. But I think what transpired in England and the recall that was announced is basically to say it was found that there are cases that, particularly of blood clotting, that are attributed to the vaccination with the AstraZeneca vaccine. But I think what needs to be clarified is that it is true that there are instances with different medications that would have adverse events of one sort or the other. Therefore, they recall out of abundance of caution. But what I stated earlier was that, and this is not only true for Namibia, it's true for other countries. When the vaccines are being administered, the person being administered is first checked for their health status, whether they have, for example, allergies, whether they have certain pre-existing conditions, etc., etc. And once that is done, it's only then that the vaccine is administered. After the vaccine has been administered, the person is again observed for another 15 minutes or so to see whether they have an adverse reaction to that. But what we also do as a ministry, and again, this is true for other health systems, there are committees called adverse events following immunization that does the surveillance of individuals who may have received a particular vaccine, so that each time a person returns to a health facility complaining about a particular matter, you check what vaccines were they vaccinated with, what is the batch of this vaccine, when did it take place, where did it take place, etc., etc. So we are saying in the surveillance activities that we have carried out with respect to the administration of the COVID-19 vaccines, particularly the AstraZeneca one, we have not had individuals come forward and say, I have experienced this particular adverse event following the utilization of this vaccine. Because again, what we are saying is, yes, the recall is out of abundance of caution, and these adverse events may happen to individuals, maybe 1 in 200 million people, 1 in 500 million people. So it does not mean that each and every person who was vaccinated with a particular vaccine would necessarily experience an adverse event. So, but as a ministry that is acting prudently in these matters, we do have experts who are following these matters. We have a national advisory committee on immunization. I think the abbreviation is NITEC, and NITEC is the one that advises the ministry, advises the government on matters related to immunization and vaccination. So what is basically, that means is basically to say, we as a ministry are following this in the interest of public health. If there is any information that is relevant to Namibia, that information will be made available. If there are individuals that would feel that perhaps they have experienced some adverse event, of course, they are encouraged to come forward. But as I'm saying, we last used the AstraZeneca vaccine, I think at the beginning of last year. That was the last time, because as I said, the uptake for AstraZeneca was so low. The stock that we had on hand actually expired on our hands, and we have not since procured this vaccine for use in Namibia.
Absolutely. I have 2 more questions for you in the remaining minutes, Ben. So one is related to vaccines. What assurance can you give Namibians in general, because there's now this notion, people are celebrating, sort of saying those of us who took vaccines, it's only a matter of days before we, before we succumb to our own decisions, our fatal decisions. Is it a concern at all in the ministry or the public health sector in general to say that there's any fears that, oh, we as the authorities presided over this thing, and now there seems to be this fear, maybe we have made a fatal decision. Is there any such concerns in the ministry?
Since independence, Namibia has implemented a program called Extended Program on Immunization. Countries that acquired these technologies years before have been vaccinating their populations against various ailments. Vaccinations have helped to save the millions and millions of lives around the world. Vaccinations have helped us as public health systems to prevent many deaths. We are on the verge of eliminating polio, for example. It's through vaccination. So we have been able to implement a program that protects children against childhood illnesses. And that, the vaccines are an important weapon in our arsenal in fighting illnesses as part of public health interventions. So the COVID-19 vaccines were developed as part and parcel of dealing with a pandemic. COVID-19 was killing people. we have seen how many people, how our health system was almost overwhelmed by individuals who are unable to breathe, who are unable to help themselves, and you either had to provide oxygen therapy or people succumbed. We have seen that. So these vaccines were developed in order to help deal with a public health event of international concern and a pandemic that was declared. So it cannot be said that we had taken a decision that we would not rather have taken. We took a decision in the best interest of defending and protecting public health. And this has been an effective decision. It has saved many, many lives. Let me just say this. Vaccines are developed not to stop a person from the infection itself. Because the infections were ongoing, the vaccines prevent a person from becoming severely ill, becoming hospitalized. That is the purpose of this particular vaccine. So that when you are vaccinated, you develop the antibodies, your body is able to protect and fight against this foreign disease-causing agent. And that is why these vaccines were produced in order to protect public health.
Yeah. Last question in 30 seconds, Ben, if you can. There was a report, I think on NBC, about an incident at the Katutura Health Center where somebody supposedly died because emergency services did not arrive to the scene on time, or that the person was not attended to on time. What can you tell us about that story?
I think it's important that when media reports information about the condition of patients, they get verified information. Basically, in short, this individual was brought to the Katutura Health Center by a member of the public in a private vehicle. Our nurses immediately attended to this particular individual. They found that the person was unresponsive. They informed the doctor who was on call. The doctor on call came, and they basically determined that this person also was not responsive. So the conclusion was basically death on arrival. In the process, while the healthcare workers were attending to this particular individual, somebody from the public, alleging to be a police officer or a former police officer, interfered and then said, no, because of this situation, this body cannot be handled. We must call the police. So this particular individual called the police. The police took longer to come. The body couldn't be moved into the health facility for further handling because the healthcare workers were told by this individual, who is claiming to be a police officer or a former police officer, that the body cannot be moved. So what we are learning from this is to say the members of the public should not interfere with the work of healthcare workers. They must allow the healthcare workers to do what is necessary to attend to patients. So basically, the body was eventually moved into the health facility after the police came. It was again handled by the doctor on call. The situation was declared to be a death on arrival. And we are engaging with the family for a post-mortem to be conducted to arrive conclusively at the cause of death of this particular individual. We have extended our condolences to members of the family. The ministry stands ready to provide the necessary psychosocial support to members of the family for the anguish that they must have gone through. It was an unfortunate incident, but of course, in each situation, it's a learning incident, and we are learning in terms of how to handle these situations should they arise further. Particularly, where we have situations of members of the public interfering with the work of the healthcare professionals.
Absolutely. Ben, it's always good to speak to you.
It was a pleasure.
Yeah, wonderful.
Thank you very much.
Yeah, that's Ben Nangombe. He is the Executive Director in the Ministry of Health, commenting on several achievements and challenges in the public health sector. Thank you for watching.